America spends more on healthcare than any other country. So why are we getting sicker? From skyrocketing obesity rates to chronic disease epidemics and mental health disorders, something isn't adding up. In this video from Health Equals Wellness, we will uncover the shocking truth behind why Americans are less healthy than the rest of the world, and, more importantly, what you can do to protect yourself. The United States is one of the richest nations on Earth, a leader in medical innovation, home to world-renowned hospitals, and yet, Americans are sicker than ever. Why does the US have higher rates of chronic illnesses like obesity, asthma, diabetes, heart disease, hypertension, Alzheimer's disease, chronic kidney disease, and mental health disorders compared to other wealthy nations? Let's dive into the facts. In the US, nearly 60% of adults have at least one chronic disease, and 40% have two or more. Compare that to other high-income countries like Canada, Germany, and the UK, and the numbers are staggering. The US obesity rate is nearly twice the Organization for Economic Cooperation and Development average, a major risk factor for many chronic illnesses. Disease number 1, asthma. Asthma affects around 25 million Americans, and chronic respiratory diseases claim more lives here than in most other developed nations. There are a number of factors that contribute. They include air pollution. The US has high levels of air pollution in many urban areas due to vehicle emissions and industrial pollutants. Air pollution is a major trigger for asthma. Studies show air quality issues in urban areas significantly worsen asthma symptoms. Rising temperatures and increasing wildfires contribute to worsening air quality and more asthma flare-ups. The US has more than double the OECD average for hospital admissions due to asthma, 120.6 per 100,000 population compared to an OECD average of 51.8. September is known as Asthma Peak Month in the US, with higher rates of asthma-related attacks and hospital stays due to triggers such as increased ragweed pollen, higher mold counts, poor indoor air quality in schools, and wildfire-related air pollution. Many OECD countries focus more on preventative care, while in the US, disparities in healthcare access mean many people only seek treatment when symptoms worsen. Disease number 2, diabetes. Diabetes is another American crisis. 37.3 million people are living with it. The American lifestyle, which often includes poor dietary habits and lack of physical activity, contributes to the higher prevalence of diabetes. The obesity rate in the US is nearly twice the OECD average, which is a major risk factor for developing type 2 diabetes. The US has the highest obesity rate among OECD countries, with 43% of adults being obese compared to the OECD average of 26%. Obesity is a key risk factor for type 2 diabetes. Every 10% increase in ultra-processed food consumption is associated with a 15 to 17% higher risk of developing type 2 diabetes. Issues such as less regulated food and agriculture industries and unhealthy lifestyles contribute to the obesity epidemic, and consequently, to diabetes. A comprehensive meta-analysis including nearly 1.1 million individuals found that moderate intake of ultra-processed food increased diabetes risk by 12%, while high intake increased risk by 31%. These factors combined have led to a significant increase in type 2 diabetes prevalence in the United States over the past 3 decades, with the country consistently ranking poorly among OECD nations in diabetes-related health outcomes. Sedentary lifestyles, ultra-processed foods, and high sugar consumption have fueled this epidemic. Unlike in countries where healthier diets and active living are prioritized, the US food environment makes it difficult for many to maintain a balanced diet. Disease number 3, heart disease. Heart disease remains the leading cause of death in the US, largely due to high rates of obesity, smoking, and poor diet. What's shocking is that nearly half of American adults have hypertension, a key driver of strokes and heart failure. The US has the second highest mortality rate for ischemic heart disease among comparable OECD countries, with 113 age-adjusted deaths per 100,000 population compared to an average of 77. Americans have high rates of hypertension, high cholesterol, and diabetes, all of which contribute to heart disease. An estimated 7.3 million Americans with cardiovascular disease are currently uninsured, leading to delayed or inadequate medical care and worse health outcomes. These factors combined have led to a significantly higher prevalence of cardiovascular disease in the United States, 7,607 per 100,000 population compared to many other countries, placing it among the highest rates in OECD nations. Condition number 4, obesity. The US obesity rate is nearly twice the OECD average, with 43% of adults classified as obese as of 2023, with 23 states having obesity rates above 35%. Obesity is a major risk factor for 4 of the 5 leading causes of death in the US. They include heart disease. Obesity makes structural changes to the heart by increased blood volume and cardiac output, leading to left ventricular enlargement and hypertrophy. Excess epicardial fat promotes coronary atherosclerosis and atrial fibrillation, plus fatty infiltration of the heart muscle can cause restrictive cardiomyopathy. Obesity has metabolic effects on the body, including insulin resistance, high blood sugar, and unhealthy cholesterol levels, potentially leading to conditions like type 2 diabetes, heart disease, and metabolic syndrome. Obesity can impair the body's ability to use insulin effectively, leading to insulin resistance. Insulin is a hormone that regulates blood sugar levels, and when the body becomes resistant to its effects, blood sugar levels can rise, increasing the risk of type 2 diabetes. High blood sugar levels can damage blood vessels and organs over time. Obesity can increase cancer risk through several mechanisms, including chronic inflammation, altered hormone levels like estrogen and insulin, and changes in cell growth and division. Obesity causes hormonal changes which include estrogen. Fat cells produce estrogen, and higher levels of estrogen are linked to increased risks of breast, endometrial, and ovarian cancers. Obesity often leads to insulin resistance and higher insulin levels, which can promote cell growth and potentially lead to cancers like colon, kidney, and prostate cancers. The complex nature of obesity, influenced by factors such as genetics, environment, and socioeconomic status, makes it a challenging public health issue, requiring comprehensive prevention and treatment strategies. Obesity also increases the risk of cerebrovascular disease, or stroke, by promoting conditions like high blood pressure, heart disease, and type 2 diabetes, which damage blood vessels and increase the risk of blockages or rupture. Here's the paradox. The US spends more on healthcare than any other high-income country, yet ranks poorly in outcomes. A recent study found that the US has higher rates of deaths from avoidable or treatable causes than comparable nations. In 2024, the average life expectancy in the US was 78.4 years, which is lower than the average of 82.5 years in comparable countries, reflecting a persistently wide difference in life expectancy. The numbers don't lie. America is facing a health problem. So, what can we do about it? It starts with prevention by improving food policies, promoting active lifestyles, and making healthcare more accessible. Other countries have tackled these issues head-on. It's time for the US to do the same. If you found this video informative, don't forget to like, subscribe, and share. Let's spread awareness and push for a healthier future.